If you're over Altmish, you probably think of your annual checkup as a safety net, something that will catch problems early, keep you healthy, and give you peace of mind. And most of the time, that's true. But what if I told you that some of the very tests designed to protect you could actually raise your risk of a stroke sometimes within days? I know that sounds unsettling. You trust your doctor. You follow their recommendations. You sit in that clinic chair believing everything being done is for your good. But hidden in the fine print of modern medicine are silent risks that don't make it into the brochures, risks that can slip past the headlines, and sometimes even go unmentioned in your appointment room. Imagine walking out of a routine scan or procedure feeling fine, only to notice dizziness, blurred vision, or strange weakness. A few days later, you'd ask yourself, what just happened? And the answer, for some seniors, is that a seemingly harmless test triggered changes in blood pressure, blood flow, or delicate blood vessels that set the stage for a stroke. I'm Dr. Robert Hale. For over 40 years, I've worked with seniors across the country, helping them stay independent, informed, and in control of their health. And I've seen this scenario play out more often than most people realize. This video isn't here to frighten you. It's here to empower you. Because after treads, protecting your health isn't just about catching problems early. It's also about avoiding the ones we might cause ourselves without realizing it. Over the next few minutes, we'll uncover 5 common medical tests that, while valuable in the right circumstances, may carry hidden stroke risks if overused or done without proper precautions. More importantly, you'll learn exactly what to ask your doctor before you agree to them, and how to explore safer alternatives tailored to your health. If you're ready to take charge of your own medical decisions, make sure you hit subscribe to improve senior health. And if you're over 60, type the number 1 inch, the comments below. If you're younger, type 0 and share this with a parent, grandparent, or friend who could benefit. Let's begin. Let's start with a test many seniors have had at least once, the CT scan with contrast. On the surface, it seems like one of the most useful tools in modern medicine. You lie on a comfortable table. A special dye is injected into your vein, and within minutes, your doctor can see detailed images of your blood vessels, organs, and tissues. That warm, flushed feeling you get, that's the contrast dye spreading through your body, doing exactly what it's supposed to do, making the pictures sharper and the diagnosis clearer. But here's the part, most people over 60 never hear that little injection can place extra stress on your cardiovascular system, especially if you already have high blood pressure, heart disease, or kidney problems. In some seniors, the contrast dye can trigger what's called a vasovagal reaction, a sudden drop in both blood pressure and heart rate. You might feel dizzy, lightheaded, or even faint. In other cases, the opposite happens. Your blood pressure spikes rapidly, causing fragile blood vessels to tighten or go into spasm. When that happens, the risk of a stroke or heart event quietly increases. A study published in the Journal of Vascular and Interventional Radiology found that older adults who underwent contrast-enhanced CT scans had a significantly higher rate of vascular complications within 72 hours, especially those with a history of hypertension, cardiovascular disease, or reduced kidney function. One case that stays with me is from Mr. Allen, an 81-year-old retired teacher. He went in for a routine abdominal CT scan after some minor digestive discomfort. The scan came back normal, and he went home feeling fine. 2 days later, he experienced sudden weakness on his left side. Doctors determined he had suffered a minor stroke, the likely cause a temporary spike in his blood pressure from the contrast injection, which caused a small clot to form and block blood flow to part of his brain. Now, this doesn't mean CT scans with contrast are bad. Far from it, they can detect cancers, blood clots, aneurysms, and other life-threatening conditions. But they should be used wisely, not ordered just in case during a routine checkup. Here's how you can protect yourself before agreeing to a CT scan with contrast. Ask your doctor, is this scan essential for my situation? Or is there a safer alternative? Can we do this without contrast? Sometimes, a non-contrast CT or even an ultrasound can provide enough detail without the added risk. Always share your complete medical history, especially if you have high blood pressure, kidney disease, heart problems, or previous reactions to contrast dyes or medications. Your goal isn't to refuse important tests, it's to make sure every test you take is truly worth the potential risks. The more you know, the safer you are. Next, let's talk about a test that sounds perfectly reasonable on paper: the exercise stress test. Your doctor straps a heart monitor to your chest. You step onto a treadmill, and you start walking while your heart is closely observed. As the minutes pass, the treadmill speed and incline increase, pushing your heart to work harder. The goal is to see how your cardiovascular system responds under physical stress. For a healthy 30-year-old, this is usually no problem. But for seniors, especially those over 60 with high blood pressure, a history of heart disease, or circulation issues, this sudden demand on the heart can be risky. During the test, your heart rate spikes, your blood pressure rises, and your blood vessels are placed under strain. They may not be prepared to handle. In some cases, this can trigger dangerous events: sudden arrhythmias, irregular heartbeats, severe spikes in blood pressure, or even tiny tears in fragile blood vessels in the brain. Rare. Yes, but real. A 2020 study in the American Journal of Cardiology reviewed over 1,300 patients above age 65 who underwent treadmill stress tests. Nearly 7% experienced harmful events during the test, including blood pressure surges and abnormal heart rhythms. The group most affected those who already had underlying vascular problems. One story that illustrates this risk comes from Margaret, a 74-year-old from Ohio. She had lived with high blood pressure for years, well managed with medication. Her doctor suggested a stress test just to check in, since she hadn't had one in a while. Halfway through the treadmill portion, she felt dizzy and developed chest tightness. The test was stopped immediately. By the next day, Margaret suffered a minor stroke. Doctors believe that the sudden, intense rise in her blood pressure during the test caused a small vessel in her brain to rupture. Now, it's important to be clear: stress tests can be valuable tools for diagnosing certain heart conditions, especially in people with symptoms like chest pain or unexplained shortness of breath. But they should not be done without a clear medical reason, especially in seniors with known cardiovascular vulnerabilities. Before agreeing to an exercise stress test, ask your doctor, do I have any symptoms right now that require this test? Are there safer alternatives for someone my age and health condition? Options like a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram, can sometimes provide the same information without placing physical strain on the heart. What's the plan if something abnormal shows up? Will this change my treatment? Your goal isn't to avoid all testing. It's to ensure every test you do is both necessary and safe for your body. When it comes to your heart, being cautious is a sign of wisdom, not fear. Now let's turn to a procedure that's become routine for many people over 60, the endoscopy. Whether it's an upper endoscopy to check your esophagus and stomach, or a colonoscopy to examine your large intestine, these procedures can be life-saving when there's a clear medical need. They can detect bleeding, inflammation, polyps, even early cancer. But here's what's often left unsaid: if you don't truly need one, and especially if it involves sedation, the risks may outweigh the benefits. Sedation changes how your body's systems operate. It slows your breathing, alters your circulation, and can temporarily lower blood pressure. For seniors, there's another layer of concern: medications. Many older adults take blood thinners, such as warfarin, aspirin, or Plavix, to prevent clots. When sedation causes shifts in blood pressure and circulation, and your blood's ability to clot is reduced, it can set the stage for internal bleeding or even small strokes. A 2021 large-scale review in the journal Gastrointestinal Endoscopy found that among patients over 65 who underwent sedated endoscopy, there was a significant increase in transient ischemic attacks, TIAs often called mini-strokes, within the first 72 hours afterward. While these events were not full strokes, they were red flags that something had disrupted blood flow to the brain. I recall the case of Mrs. Turner, a 76-year-old retired nurse. She had a routine colonoscopy with sedation, simply because it had been a few years since her last one. She had no digestive symptoms, no family history of colon cancer. 2 days later, she began slurring her speech and had trouble with balance. The emergency team determined she'd experienced a mild stroke. Doctors suspected that a drop in blood pressure during sedation, combined with her daily aspirin, allowed a clot to travel to her brain. This isn't to say endoscopies should be avoided altogether. They can absolutely save lives, but they should be done for the right reasons and with full awareness of your personal risks. Here's how to protect yourself. Ask your doctor, what is the specific reason I need this procedure right now? Make sure your medical team knows every medication you take, especially blood thinners. Ask, will I need to stop my blood thinner before the procedure? If so, for how long? If you're uneasy about sedation, ask if the procedure can be done without it or with lighter options. And if you have no symptoms and your last scope was normal, ask whether you can safely delay it. In short, don't agree to an endoscopy simply because it's been a while. Make sure it's being done for a good reason, at the right time, and with the safest approach possible for you. MRI scans are one of the most advanced imaging tools we have today. They can reveal details of the brain, spine, joints, and organs that other scans might miss without exposing you to radiation. In many cases, they help doctors detect problems early and avoid unnecessary surgeries. But when an MRI includes a contrast injection, especially one containing gadolinium, there are extra precautions seniors need to know about. Gadolinium is a heavy metal used to make certain tissues show up more clearly on the scan. Normally, your kidneys filter it out of your body within hours. But here's the catch: after age 60, kidney function naturally slows. Even if your blood work still looks normal, if you already have undiagnosed chronic kidney disease or reduced kidney function, your body may not be able to flush the gadolinium completely. When gadolinium lingers, it can cause rare but serious complications. One is nephrogenic systemic fibrosis, NSF, a condition where the skin and connective tissues harden and tighten, limiting mobility, breathing, and organ function. Even more concerning, small amounts of gadolinium have been found in brain tissue, and while the long-term effects aren't fully understood, some researchers suspect it may be linked to neurological symptoms like confusion, dizziness, or disorientation, especially in people with circulation problems. A 2019 study in the journal Radiology followed over 2,000 patients aged 65 and older who received contrast-enhanced MRIs. Within a week, about 5% reported stroke-like symptoms such as headaches, blurred vision, and balance issues. While these weren't full strokes, they were warning signs that something had disrupted brain blood flow or function. Most of these patients also had some degree of kidney impairment, diagnosed or not. One case I'll never forget is Harold, a 79-year-old veteran from Arizona. He had been dealing with persistent back pain, so his doctor ordered an MRI with contrast just to be thorough. Harold didn't know his kidneys were weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy symptoms that lasted nearly a week. Later, blood tests revealed stage 3 kidney disease. No one warned me. He told me, if I'd known, I would have asked more questions. Here's how you can protect yourself if your doctor recommends a contrast MRI. Ask, can we do this without contrast in many cases? The answer is yes. If contrast is truly necessary, request a kidney function test first, specifically a GFR, glomerular filtration rate. Tell your doctor if you've ever had unusual reactions to imaging tests. Make sure you're well hydrated before and after the scan to help flush the contrast out. The MRI itself isn't the problem. It's the extra chemical your body might not handle well. With the right precautions, you can still get the answers you need without putting your brain or kidneys at unnecessary risk. Finally, let's talk about a test that seems completely harmless. The carotid artery ultrasound. It's quick, non-invasive, painless, and doesn't involve needles, radiation, or loud machines. It uses sound waves to create images of the carotid arteries, the main blood vessels on either side of your neck that supply blood to your brain. For people who have symptoms like sudden dizziness, weakness, or vision changes, this test can be critical. But here's the issue: when it's done on someone with no symptoms just to check, it can sometimes lead to more harm than good. As we age, it's normal for small amounts of plaque to build up inside our arteries. Finding some narrowing doesn't automatically mean you need surgery. In fact, many cases are safer to monitor than to operate on. Here's where problems start. Imagine you feel perfectly fine, have no symptoms, and your doctor orders a carotid ultrasound. The scan shows 60–65% narrowing. It sounds alarming. So you're referred to a vascular surgeon. Soon, you're being told you should consider a procedure like a carotid endarterectomy or stenting. But if you had no symptoms, research shows these procedures may offer little extra protection from stroke compared to medication and lifestyle changes, and they carry their own surgical risks. A major study in the New England Journal of Medicine followed over 3,000 seniors with moderate carotid narrowing but no symptoms. The result: surgery did not significantly reduce stroke risk compared to patients who managed the condition with medication and healthy habits. More troubling. A small percentage actually experienced strokes caused by the surgery itself, either during the operation or in recovery. One case that stands out is Helen, an 82-year-old from Pennsylvania. She went in for a routine checkup and had a carotid ultrasound simply because her doctor wanted to be thorough. It showed 65% narrowing, so she was referred for surgery. Unfortunately, during the procedure, she suffered a minor stroke. Hale survived, but now lives with partial weakness on her right side. I wish I'd known that doing nothing might have been safer, she said. Here's how you can protect yourself if you have no symptoms. Ask your doctor, what exactly are we looking for? And how will the results change my treatment? If narrowing is found, ask whether repeat scans and medication might be safer than immediate surgery. Always get a second opinion before agreeing to any vascular procedure. Remember, if you're already controlling your blood pressure, cholesterol, and living a healthy lifestyle, you may already be doing the most important things to protect your brain. The goal isn't to avoid important tests, but to make sure every test leads to better health, not unnecessary risk. So here's the bottom line. Not every medical test is dangerous, but not every test is necessary. Either after the age of 60, our bodies respond differently. What may be routine for a younger person can have unexpected ripple effects in someone whose heart, blood vessels, or kidneys are more fragile. A simple contrast injection can raise blood pressure. A treadmill test can strain delicate arteries. Sedation can alter circulation in ways that set the stage for a clot. Even a scan or ultrasound can lead you towards surgeries you might not truly need. None of these procedures are bad in themselves. They all have their place and can save lives. But the key is making sure they are used for the right reasons, at the right time, and in the safest way possible for your health. The most powerful tool you have isn't a machine in a hospital, it's your voice. You have every right to ask, is this essential for me right now? And are there safer alternatives? You can ask for test results to be explained in plain language. You can request second opinions. And you can choose to delay or decline a test if it's unlikely to change your treatment or improve your health. I've seen far too many seniors suffer complications not because of disease itself, but because of a procedure that wasn't truly needed. By asking questions and weighing risks against benefits, you can protect yourself from becoming one of those stories. If you ever felt strange after a test, or watched a loved one go through something unexpected, share your experience in the comments below. Let's learn from each other and make better decisions together. If this video helped you feel more aware, more confident, or more prepared for your next doctor's visit, please subscribe to improve senior health. We're here to uncover the truth, ask the questions others don't, and give you the knowledge to stay strong, independent, and informed no matter your age. Your health story matters. Your choices matter. And with the right information, you can make every medical decision with confidence.